And this isn't something that the CDC has just put out for coronavirus. It's for all viruses. We want to be looking at what we should be doing for everything else in general.
Welcome to the Healthy and Clean Show, where we have conversations to improve your life and business. This show was birthed out of our desire to have a healthy and clean lifestyle ourselves. Make sure that you hit that subscribe button so you don't miss any of our episodes. All right, let's get right to it.
All right, we're excited to have Clean Gene here today from Universal Cleaners. I'm personally excited this because he's been a friend to me. He's been an influencer to me. He's been a mentor in a lot of ways. And so I'm so excited to have him here on a lot of levels. And Gene, I don't know if you know this. I don't know if this is something I can share about you. Sure. But your name, so Gene.
Yes.
Clean, we know Clean Gene from
Absolutely.
Universal. But Gene, can I say what your real name is?
Absolutely.
Okay, Eugene. So when I met him, I realized, so our parents are boomers, right?
That's right.
Okay, so
name.
My middle name is Eugene,
There you
and
go.
my first name is Dennis. So how many guys you know my age with the name Dennis? Eugene Fellows Jr.
That's right.
And
I'm
you
a
are
junior as well.
Gene
Eugene Frank Lafave Jr.
Jr. So we've got so much in common.
Old
And
souls.
Old souls. Our parents are boomers. They kept the tradition going with the names. And
Absolutely.
so I'm excited to introduce you and to our audience and bring you on as just an expert in your field of cleaning, of the science behind it is something I've always looked up to you for. Is just you brought me into a deeper level of understanding so many ways. And we want to do a special to help our customers, help our audience here to understand the coronavirus, what's happening, a lot of fear, a lot of things happening. So that's why we're here today. We want to really come together and impact our community. And I think you believe the same thing is we're friendly competitors, we're friends, but we can make a difference here in Traverse City. And so if you want to just share
Absolutely.
who you are and what makes you an expert. And
So obviously Clean Gene, Universal Cleaners. We clean about 1 million square feet a night, just commercial space, office, industrial, schools, that type of thing. We have about 50 employees, and we've been in business for about 12 years. So we're very proud of what we've built, the employees that we have, the clients that we have, and the work that we do. So when you called me here to talk about coronavirus, it's obviously very pertinent over the last couple weeks. We've gotten a lot of calls from our clients, from people who aren't even our clients, asking questions, what they can do, what they should be doing, and all of that. And I think we'll get into that here in a little bit. But first, I think what's important to discuss is what is coronavirus, or as it's also called, COVID-19. And it's a novel virus. So coronavirus has existed for a long time, but I think the easiest way to think of this would be each year the flu is a little bit different in our country. Well, this is a novel form of coronavirus, and this form of it, COVID-19, happens to be what experts think more deadly. So that's what's really scaring people. It swept through China, and now it's across the world and even in the United States. So that's what's really scaring people. And to look at the mortality rates, what they're guessing right now, about 3% of people that contract this are dying. So it is really something that we should look at. Many of those people have other health issues or are old, but nonetheless, we should all be doing what we can to reduce the spread of this illness, because even if it didn't affect us as much, it could affect one of our loved ones. So that's really important to recognize. But it's also important to recognize what it is. It's a virus, very similar, like I say, to the flu, although can be much more serious. So that's number one, what it is. And then we look at what can we be doing to slow the spread or prevent the spread in certain cases. Obviously, the number one thing that we're going to do is we're going to look at CDC recommendations. And this isn't something that the CDC has just put out for coronavirus. It's for all viruses. We want to be looking at what we should be doing for everything else in general. Because we may not see coronavirus here in northern Michigan. We may see it. either way, we should be doing these things to prevent other viruses from spreading as well. So we're going to look at CDC recommendations, and what's the top one?
If you mind if I interject?
Sure.
So one thing you said to me on the phone yesterday that really impacted me is fear in a lot of times the news is, we hear clips and it instills fear. Mm-hmm. And so fear is the lack of control.
Sure.
And so just as you're about to go into, like, we think, and a lot of times, like, this is scary, we can't do anything about it, right?
Sure.
And so to eliminate that fear, we take action.
Absolutely.
And that's something you said to me that
Yep.
I was like, yeah, we can take action, because there's two things that people are doing right now.
Yes.
Is either fear or there's nothing I can do about it anyways.
Yeah.
I think that's kind of that two opposites where you're gonna give us some great advice on what do we do, and we
Absolutely.
take control so we're not in fear.
And if we take control, to your point, we aren't in fear. I also equated it to driving a car. There are inherent dangers that we need to recognize when we drive a car. But if we do certain things, we are going to greatly reduce that risk. And I don't think the solution is not driving the car, right? I don't think the solution in this case is not going out in public or just completely shutting down as a society. I don't think that's a great solution. We should be doing some other things right now. So to jump into that, number one, first and foremost, hand washing. Hand hygiene is very important. Now, to jump back into coronavirus, it is a droplet virus, meaning it is spread through coughs, through the air, through droplets. But it's also, once those droplets land on a surface, it is spread through contact. It's a lot more difficult to stop the droplet portion, but we can stop the contact portion. And it lives on surfaces, we know, right now with the temperatures the way they are, it lives on surfaces for, 10 to 15 hours. That's a long time. Yeah. So we want to be washing our hands. That's number one, first and foremost. Second thing we can do with hand hygiene is hand sanitizer. If you're properly washing your hands, you're properly using hand sanitizer, and we can get into that a little bit later, those are the top two things that you can be doing to protect yourself. Now, when we look to protect an entire facility, we're going to have to do some more things. Number one thing with protecting a facility would be cleaning that facility. Everybody wants to jump right to the disinfecting, which can be important, but number one, we have to clean it. We don't disinfect a dirty surface. We disinfect a surface that we've already cleaned. It's usually a two-step process. So number one, with the facility, we want to be doing a really good job cleaning. And that would involve hiring a company like yours or a company like mine and making sure that we're dotting our I's and crossing our T's in all those areas with those surfaces that are going to be touched. And then the second thing that we can be doing in facilities is a disinfecting program. You can either spray the disinfectant on. The challenge is it does need to dwell, what's called dwell time. There's kill claims on the back of most of these disinfectants. They're upwards of 10 minutes in certain cases to kill things. That's a long time for something to remain wet. Now, we may still do that, but then that brings us to the other option that we were going to talk about here today, and that is the Clorox Total 360 machine. It's an electrostatic sprayer that we can come in and spray the facility, and it positively charges the particles that it's spraying through, a disinfectant, and those particles then stick to the surface, all the way around the surface. So they really encapsulate it, and we feel good about what's going to happen after that. Now, these processes have to be repeated as well, right? It's not enough to wash your hands once a day. Yeah. You should be washing your hands very, very frequently. You should also wash them before you eat or drink. You should never touch your face, and if you have to, you should wash your hands before and after. Same thing, though, when we segue over into the cleaning of a facility and disinfecting a facility. It's not enough to go in and clean that facility once and say we're done. That would be like washing your hands once in the morning and saying we're done. No, you have to repeatedly do that because it keeps getting infected with other things. Yeah. So that's not to drive fear, that's simply to say this is what you should be doing. So I think those are my recommendations to all of my clients, and that would certainly be the recommendation we would give to your clients as well.
And a lot of people, cleaning kind of has this different, varied understanding.
Sure.
And some people, it's just dusting. Mm-hmm. There's a concept of, just dusting. It's clean enough. It's not bad. And everybody has a different idea of where it is, where we've taken the concept of healthy is your space, and right now of, washing your hands more often, cleaning your spaces more often, whether it's your home or your office. And obviously we both own cleaning companies. I do residential as well. And I was just thinking about that aspect of it is, get to cleaning your home more often. Start at home, start, in our businesses, in our schools, and increase right now. I mean, in this, whether it's the flu, the colds, corona, it's increase these things. Sure. Let's focus on them and increase them, whether it's just we're taking action in our homes and cleaning them more often. We're hiring a service, we're cleaning our offices between the cleaning services even. Absolutely. Just the importance of cleaning, of just wiping it off, not just dusting, but actually cleaning
Sure.
it. So.
We have a lot of people who come into our conference room, for example, in our office. So I believe I practice what I preach with our clients. In our conference room, for example, we have a lot of people come in and out. We have our service come in and clean that on a regular basis, but in between, to your point, we're cleaning those surfaces that are touched very frequently. Is it going to be perfect? There is no perfect with this. We are simply trying to reduce risk as much as possible, contribute to a safe and healthy environment for everybody. So,
which actually, like in a business realm, one of the things that you probably even understand more than me is reducing sickness and really actually making more money in a business sense of, does a cleaning service, the concept, does it actually cost you money or does it actually make you money? I'm just wondering what...
To your point with that, cleaning is one of the lowest cost items that you can do to improve employee morale. If you look at the cost per employee when you get a cleaning service, it's one of the cheapest things that you can do to improve employee morale. Also, to that point, on the Clorox Total 360 website, there is some information on when they came out with this, even before the coronavirus. This was already out. That is one of the main reasons, because in a commercial environment, if you can reduce absenteeism, it's a huge cost to business. So not only is it good for the employee to not get sick, but it's also good for the employer. So for example, a lot of NBA and professional sports teams bought these right when they came out because they're paying their players a lot of money and they can't miss a game due to the flu. So they go in and hit their locker rooms with these very regularly, which makes sense, right? They're investing in their employees. So absolutely, that is an excellent point with this.
Yeah, I think that's really great, and I think that's a misunderstood concept of cleaning. And I'll tell people, our goal is to actually make you money. Sure. We're going to reduce sickness in your office. We're gonna bring it to a healthy state. And obviously, we can only do that to the point of what we're cleaning, but just having that understanding of clean and just around this coronavirus of understanding, let's bring up that understanding of cleaning, and it is affordable, and it's actually could make you money. Mm-hmm. It actually could increase productivity in your office, reduce sickness, and which is, when absenteeism happens, it costs you money. It costs you production, and even dust in your office, even going back to dust, of that actually, the evidence of it reducing productivity in your office, and you said is morale, but also health of your employees. Sure. But I think that's awesome. Should we get into...
We will in just one second. I wanted to say one other thing with that. Even beyond the productivity, even beyond the morale, I feel as an employer, and I'm sure you do as an employer, we have an obligation for the safety, to help with the safety of our employees. So anybody that has an office where they have a lot of employees, I think most people feel a similar way. They have an obligation to provide for their employees' well-being, for the safety of their employees. So we can never foresee everything, but we should be doing the things that we know will help with that, as we outlined here a couple minutes ago. So we'll get right to this.
Yeah, one of the things you said yesterday, I was just remembering, is with this, if you're bringing awareness in your office. You're saying, hey, wash your hands, not just restaurants with a sign in the bathroom, but which is common, but not as common in an office. No. Hey, wash your hands. Absolutely. Bringing awareness is a main thing we can do right now, is bring awareness to your employees, wash your hands. in our homes with our children, focusing on that. It's a simple thing. We can control this.
Yep.
Hey, go wash your hands before we eat. These things that you're laying out, cleaning more regularly.
Sure.
Home, office, bringing in companies, or ramping up your cleaning if you can't do that.
Did you want to get into a little bit too with the proper hand hygiene, how to properly wash your hands here in this segment?
Yeah, go ahead.
Okay, so when we're going to wash our hands, there's a lot of misconceptions as to how to do this. Number one, most people think hot water's better. You know, hot water, warm water can help reduce soils on your hands and break them down, but it's not going to kill any germs. It's not going to be hot enough. If it were hot enough, you'd scald your hands really badly. So water in general, using plenty of it. If it is warm, yes, it can help to break down some soils, but it doesn't have to be hot or warm water. Cold water will help as well. And then when we go over to the soaps that you're going to be using, you don't need to be using an antibacterial soap outside of a healthcare setting. They're not necessarily recommended by the CDC. What you do want to make sure you're doing, though, is not using bulk hand soap. What I mean by that is we never refill a container, because in order to refill the container, you have to properly wash the container and dry it before you do that, and that's just not practical. So what many facilities have gone to, which is very good, is a closed loop system. So a bag that goes in there, you replace the whole thing. Or if you're in your home, you buy a separate container each time. If you do have to refill it, you need to know that you really need to wash it well and then dry it completely, let it air dry before you refill it. Or you can have actually bacteria in your soap. Even antibacterial soaps can grow bacteria, oddly enough. So we want to make sure we're using water, proper soap, and then when we wash our hands, there's all different kinds of recommendations, but generally is 30 seconds, and you can hum happy birthday to yourself twice, and that is generally what they teach medically people to do when they're washing their hands. You want to work it in, get all the crevices, obviously in your fingernails as well as possible, and then rinse well. Then dry your hands with a clean towel or air dry your hands. So that's the important way to do that. Now, when we go over and use hand sanitizer, it's very similar. You want to make sure when you're using the hand sanitizer, number one, you have enough of it. You don't need too much, but you need enough of it. Number two, you work it into your hands really well. You get every surface. And the tendency with hand sanitizer sometimes is to use the hand sanitizer and just do one of these. And then they think their hands are clean. That's not true. You're going to have bacteria and viruses all over your hands. So you got to work it in really well. Then you want to use it and work it in until it evaporates naturally. That's when you know that you've properly disinfected, cleaned your hands with hand sanitizer. So those are the two things that I would really recommend to people. Do it properly, whether it's washing your hands or using hand sanitizer.
Yeah, that's really good. We usually ask, what's one actionable step that people can take from this
hand hygiene,
from this conversation?
Yes.
Because even that piece of information with the soap was so profound to me yesterday, because I started looking at, I've been refilling soaps.
Sure.
And
that's, by the way, that's a CDC recommendation, so people can verify that as well. That's not something that I'm saying. That comes through the CDC.
Yeah.
If you are going to refill them, you have to take them off, wash them out, air dry them, which, as we know, in most cases isn't practical and isn't happening.
Yeah, so buying single soaps, throwing them away, putting a new one out.
Yep.
And it's okay if my kids are washing with cold water.
Absolutely.
So I've thought about that.
If we have warm water, it's going to break down the soils better, but cold water works well too.
My kids, it's funny, when you said that, I thought about my kids, because they hate hot water. They're like, I'm like, turn on the hot water, and they just, I can't get them to do it.
It's not hot enough to kill anything. So, and the interesting thing too, back to the point with the bulk hand soap, is if you are refilling, and not washing out between, it's actually proven that your hands are dirtier after you wash them, much, much dirtier than without washing at all. So that should give pause to everybody with that, to not use the bulk hand soap, or if they are, making sure that they're washing everything out properly between.
Yeah, that's really. So, John, can you throw away our hand soap in there for me, please? I thought about
Probably
that.
A good idea.
Yeah,
probably a good idea.
We're gonna get some new ones in there.
Okay. Do you want to segue to the Clorox Total 360?
Yeah, we can do that. I think the one point before we went do it, I was kind of wrapping back to what I was saying was, we're doing all of these things. You gave us great advice. throw out our hand soap, get some new ones, get the refillable bags if you're a commercial space, which a lot are switching to the throwaway bags.
Yep.
And get rid of your old refillable metal ones or convert them. We're doing all these things. We're cleaning. And the point you made about this that I really liked and to drive home is when we're doing all those things, what is that one more thing we can do? What is that one step that you're saying, like football, program, they're doing that one more thing. Sure. And to protect against coronavirus, this is a new technology. This is that one more thing.
Sure. Now, I do want to clarify with that with coronavirus. People are hesitant to step out onto a limb and say it kills this or kills that without lab testing. Now, with COVID-19, the current form of coronavirus, no one is going to step out on that limb and say that it specifically is killing this. But it is killing every virus around it on the spectrum. So I think that we can all have some level of confidence that that's a good thing to do, right? And to walk you through a little bit with this before we demonstrate it, it's going to use the chemical that is in here. It's a disinfectant. And also I do want to go and explain disinfecting a little bit before we get into this, if that's possible. Yep. So there's 4 levels here that we want to kind of discuss. There's cleaning, there's sanitizing, there's disinfecting, and then there's sterilizing, in that order. Cleaning, sanitizing, disinfecting, and sterilizing. Now, sterilizing is when you're using surgical equipment, it has to be sterile. And it's packaged, it's sterile. Cleaning isn't killing anything, it's simply removing things. And then we go up from there, obviously, to sanitizing and then disinfecting. It has to do with how much you're killing. So when you see on a label disinfectant and it kills 99.99%, that's what they're referring to. Sanitizing is a lower kill claim than that. And generally you'll see sanitizing when it comes to food surfaces or soft surfaces, like the chair that you're sitting on. No one can give you a disinfecting claim because it's a porous surface and we simply can't kill everything. But this is a disinfectant, so when it's sprayed on a solid surface, it's going to disinfect, meaning kill that much. It's also a quaternary disinfectant. So I don't want to get overly scientific with everybody, but quaternary disinfectants are ammonia-based and they're hospital-grade disinfectants. Quaternary disinfectants have been in use for years. They're kind of the standard when it comes to disinfecting facilities. So it's something that's very reliable. Also, when you have the Clorox name on something, people generally trust it, as they should, because Clorox has been working, disinfecting things and killing germs for years and years. So that's a little bit of a rundown. Then we also mentioned it is an electrostatic sprayer, so that's the unique thing. So it's going to come through here, it's going to mist it, and it's going to charge those particles. So think static. It's going to stick to the surface. And not only is it going to stick to the front of the surface, it's going to stick 360 degrees all the way around the surface. Now, I don't have a fluorescent loaded in here, but I have been a part of the demonstration when there was a fluorescent loaded in, and you can literally see under black light the underside of every surface is coated. So that's the beautiful thing is we know when we spray this, we're getting all of the surfaces, right? And that's the true advantage over just disinfecting through the traditional method.
So you can go into a space, spray chairs, desks, fixtures, touch points, and it's going to fully wrap it, where otherwise we have to somehow spray it, wipe it. This is going to...
And then there's human error involved in that when there's every single surface. So that's the name, the Total 360, and that's what it means. It coats everything 360 degrees. That's why they named it that. What I'm gonna do here is I'm gonna spray both of these chairs. We're just gonna demonstrate how quickly and easily this is done, so you can imagine how we can go through a facility and get the whole thing. So the machine's already loaded with the disinfectant. It's powered up. It's literally a push of a button. Now, when our employees come in, they're going to be wearing masks, other personal protective equipment to protect them, because they're going to be spraying a whole facility. In this small demonstration, we're not as concerned with that. Also, for our client safety, we want them to understand that once this is sprayed, once we're out of that area, it is safe. It is safe to use. The only area that we have to be concerned with are food contact surfaces. This product is a disinfectant. We don't want to spray it on food contact surfaces. If we do, we come back over and we wipe that surface with potable water. So we're going to wipe that off so that we're not harming anyone. But generally speaking, very, very safe. Yes, and it's going to kill the things that we don't want and be safe for human contact later. And you're going to see it's going to come out in a very light mist. It's powerful, but it's a mist, so it's not going to leave the surface overly wet. That's it. I told you it would be quick.
Yep.
That's it. And believe it or not, if we had fluorescent contrast loaded in here, the underside and backside would also be coated. So that's the beauty of the Clorox Total 360.
Yeah, and I've seen this in a demonstration before, actually in a school setting with a desk, and it just literally wrapped the entire desk. It wrapped that chair just in that little bit of in a shot. Yeah. So wherever you're touching, if you're sitting here and you were touching the leg or you're touching the side, and especially with kids or in an office environment, you don't know where you're going to be touching. So that is amazing. So a customer, they were like, oh, this is something I could do. A process for that would be, start cleaning, clean off your desk, remove items off the desk, get ready, so we can come in and clean it. So we're talking about wiping it down, cleaning it, removing those personal items, whatnot, and then being able to spray this. It won't get anything wet, really, but it is somewhat, papers, and you should probably remove that.
Correct. Well, and it also, to remove your papers, clean up your desk, that's going to allow us to clean more surfaces, where if you leave the paper on top, we're not going to be able to clean that surface and then disinfect it with this. So we want it to be able to at least get as much of the surface area as possible. So that's our recommendation, is clean up your area. We will, if it's us, we come in and clean, then we do this. If it's somebody else, we say, please clean it first, clean all your surfaces first, then we will spray this. As I mentioned, it's a kind of a two-step process whenever you're doing any disinfecting. So, and if people want to do this and utilize the program, they can contact yourself if they're your customers or people that know you. And we've offered this to Jenny Clean as a part of your tool bag as well. And if they're one of our customers or someone that knows me, they can obviously reach out and we'd be happy to provide them with a quote. It is a very quick process, but the value in it, I truly believe in it. We invested in this before the corona outbreak because we know of all of the different things that can be quite concerning. So,
what would be a good program? What do you suggest in this? Even if somebody's listening and saying, "Hey, this is something I'd like to do." How many times? Is it one shot? Is it multiple shots?
You and I have talked about this a lot in the past. When you disinfect any surface, whatever the method may be, people always ask, how long does that last? Well, it lasts until somebody comes and contaminates the surface again by touching it. So that's really going to be up to the client on that. If you're going to do it, having a repeat program, it's much cheaper for us to come in and do that as well because we know the facility, we can do it much more efficiently. So it is more cost effective to do it more times. And also, you're continuing to stay on top of things. But also for one-time services, if you did have, God forbid, an outbreak, even the flu this year, people have had to close down certain facilities. That would be a good idea before you reopen to come in and spray the surfaces, right? So it could be either a one-time thing, but I would say you're only going to kill, you better be confident that it's not going to come back, whatever you're trying to kill. Or part of that recurring program. We like to do things on the weekends with this because that means that the facility was clean, say, on a Friday night, and then we can come in, we have all weekend to make sure we do a really good job. So that's, once a week is something that I think is a good aiming point, but we're not pushing that with anybody. I think that's for them to evaluate their risk factors in each individual facility.
And it's a great preventative tool.
Correct.
This is also preventative. Also, you are having the flus going through your office. Absolutely. Let's stop that. So
it's going to help slow anything down, flu, other viruses, bacterial infections and whatnot. It's certainly going to reduce a lot of those things. So,
awesome. Well, thank you so much.
thank you for having me.
Appreciate it.
It's good to see you.
Thank you.
We all good?